Good day, and welcome to the Good Nutrition in the New Year call. Today's conference is being recorded. At this time, I would like to turn the conference over to Jennifer Gillette. Please go ahead, ma'am.
Thank you so much. Yes, this is Jennifer Gillette. I'm the staff social worker at National Bone Marrow Transplant LINK. I'd like to welcome you to our Lunch and Learn with the LINK. This month's program will focus on strategies for good nutrition in the new year. A special thank you to our sponsors for today's program: the Leukemia and Lymphoma Society, Insight Corporation, Pharmacyclics, and Janssen. We also thank our esteemed LINK partners. Just so everyone knows how the call is going to go today, we're going to have a brief little introduction for those who might not be aware of the LINK, and then we will hear from Amy Carion, Dietician at Henry Ford here in Michigan. And then we'll open up for questions because Amy might have to scoot a little early just to get with some of her patients today. And then we will go to our survivor speaker, Rhonda Kokot, and then we will open the floor for questions for her as well. And then we'll wrap up, and I'll give you some of our upcoming programs that you can check out. So for those who may not be familiar with the LINK, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. We provide resources, support, and education. Some of the resources we provide to help families navigate their transplant journey are our webinars, podcasts, blogs, our Lunch and Learn calls like the one you're on today, and we have these on a variety of topics such as chronic graft versus host disease, disease-specific information, caregiving, coping, treatment options, and survivorship. We have an active Facebook page with daily inspiration, breaking news, and relevant tips for survivorship. We have our peer support mentor program for both patients, caregivers, and even donors. We have our second birthdays recognition program, and we have a variety of books, and we give referrals to needed resources and emotional support. So if you need any extra help on your journey, please feel free to reach out. Before we begin today's program, I would like to review just a couple housekeeping items to maximize the experience of all on the call today. Please be mindful when it comes time for our questions section to try to keep your questions as concise as possible, just so we can get to as many of those questions as we can today. Also, please know that the information provided in this program is meant to stimulate conversation with your own healthcare provider, and it's not meant to replace your individualized medical plan. So now, on to the educational part of our program. We are so thankful to have Amy Carion with us today, a registered dietitian at the Henry Ford Cancer Institute in Detroit, Michigan, also covering the Macomb satellite. She works with patients while on chemotherapy, radiation therapy, and in survivorship, as well as post-operatively with breast, pancreas, and gastric cancer surgeries. In addition to her work in oncology, Amy is passionate about chronic disease prevention, living a healthy, active lifestyle, and sports nutrition. Thanks so much for being here today, Amy.
Hi, everybody. Thanks for having me. I really appreciate it. So yes, hi, everyone. Like she said, I also like to mention, too, that I cover and work with all of the stem cell transplant patients here at Henry Ford. So very fortunate to be here today. So I thought it would be a really good idea to talk about nutrition as it relates to stem cell transplant survivorship, kind of like what do we do now, as well as some of the possible, some of the increased risks for other conditions because of the transplant itself. So oftentimes, I'm sure a lot of people on this call, and certainly myself, when we have questions about nutrition, we like to go to the internet and stuff like that. One of the challenges with this is that people can just say stuff online without having research or education to back it up. So the guidelines that we really reference, we being, cancer dietitians reference, they come from somewhere called the American Institute for Cancer Research. These guidelines are fantastic because more specifically, they're part of something called the Continuous Update Project. The most recent report was published in 2018. You can find like a simplified version of this online, or you can either download the PDF, which is, I think, oh goodness, it's less than 100 pages, but maybe 70 to 90 pages long. And it goes through each of these recommendations and explains in detail kind of the research that is behind them. So it's really the gold standard when we look at nutrition and recommendations for cancer prevention and as people move into surveillance. There are 10 of these guidelines, and, some of them relate to nutrition, but many of them really relate to lifestyle. Because when you look at things like nutrition or eating habits, they're not just isolated. They have this really unique synergistic relationship with other things. So I'll talk about the not nutrition ones first and explain them and then go into the diet and lifestyle ones. So one of these guidelines is maybe someone has ever had a baby or if you are trying to have a baby. For mothers, breastfeed your baby if you can. Breastfeeding is good for both the mother and for the baby and has been shown to reduce risk for cancer later in life for both of them. One of the other guidelines talks about the importance of being physically active or exercising. Now, these guidelines are a little bit flexible, and what I mean by that, so say, like these more apply to after the transplant. Nutrition as it relates to the transplant alone is a completely different hat that we wear. But after you have your transplant and you're into surveillance, if you're able to be physically active, this is really helpful and beneficial. These guidelines go into specifics about many things and they quantify things, right? Because it's one thing to say, be physically active, but what does that mean? So current guidelines state it's best to engage in 150 minutes of activity a week. This can be broken down in many different ways. So people can think like 30 minutes, 5 days a week, but if someone's coming to me or my coworkers and saying, I can do 5 minutes, we say that's okay. Like start somewhere and hopefully build up to that 150 minutes per week. If someone is physically able to, we also talk about doing some type of strength training program because then there's so many benefits with that. It's one of the best ways to preserve or build smooth muscle tissue in our legs and our arms and our abdomen. And then two, it can really help to preserve bone health, which is really important for our stem cell transplant patients. One of the other guidelines, or it's not a guideline, it's kind of like an anecdote off the side, so I guess guideline 10.2, but it talks about the importance of staying away from smoking and avoiding exposure to smoke. The reason behind this isn't necessarily as it relates to hem-onc patients, but smoking has been linked to risk for cancers of the esophagus, which is what connects our mouths to our stomachs, and then it's been linked to lung cancer. More predominantly, though, cancers of like the tonsil, the tongue, and the salivary gland. So that's where we talk about staying away from smoking if we can. One of the other guidelines, this is really interesting and kind of controversial sometimes, but it says clear as day, do not use supplements for cancer prevention. Aim to meet nutritional needs through diet alone. In my 6 years, working with cancer patients, understandably, like these supplement companies make these claims that taking this will help to stop the cancer from growing in your body, and all of these claims. But in reality, we so badly want this to be true, because if it was as simple as saying, okay, take this turmeric or take this herb, and that would stop the cancer from growing, then there would be so much less cancer in the world. But cancer physiology is really, really complicated, and that's not necessarily going to help. There is definitely a time and a place for supplementation if someone's at risk for a deficiency. So for most of our stem cell transplant patients, once they're into surveillance, we certainly recommend adding in calcium and vitamin D, because stem cell patients long-term are at risk for osteoporosis or osteopenia, depending on how long they've been on steroids for. That's one of the long-term side effects. As well as for other cancer patients who we see, other surgical patients, we'll add in supplementation if they've had surgery and part of an organ has been removed. And then that's the thing, though. It says we want to aim to meet these needs, these vitamin and mineral needs, through our eating habits alone, which is neat. I always tell people food first. You know, the vitamins and minerals found in food have a higher bioavailability in our bodies than the supplements do. So what that means is they're absorbed and utilized more quickly, and you'll need less of them compared to if you had to have a supplement. I like to get off on tangents about supplements because I think it's really interesting. One of the other challenges with supplements, not necessarily as it relates to cancer prevention, but in general, is that supplements don't have a regulating body. So medications and various things are regulated by something called the Food and Drug Administration. So say, you know, your doctor writes an order for your steroids, and it says, I'm just throwing out a random number, like 10 milligrams of prednisone. The Food and Drug Administration knows, like, okay, we've checked, this has 10 milligrams of prednisone. Because supplements and these quote-unquote nutraceuticals, if you want, they don't have that same regulating body, they can make all of these claims that could be complete nonsense and kind of get away with it. If someone is taking a supplement, like I myself take, you know, multivitamin and vitamin D, I always encourage people to choose something that's been third-party tested. These are labs whose really job is to take these products and test them in their labs to verify that, okay, this vitamin D2 really does have 50,000 units in it. So I think that's a really good thing. If you just Google, I very seldom tell people to Google things about nutrition, but if you just Google third-party tested supplements, a good list will come up for you. So that's my little supplement tangent I get on often. Okay, so let's talk about first the things we want to stay away from as it relates to cancer risk. For cancer prevention, it's best not to drink alcohol. Alcohol consumption has been linked to cancers similar to smoking, so the esophagus, tonsils, salivary glands, and tongue. It's definitely been linked to liver cancers, as well as, and even more significantly actually, cancers of the pancreas. If someone were to choose to drink, because again, we recognize drinking can be part of special occasions, and like our speaker today celebrating her 20-year mark with her transplant, if you were to choose to have a drink, recommendations state for women, 1 drink per day, and for men, 2 drinks per day. Now, again, I mentioned earlier that I really like that these guidelines go ahead and quantify stuff. 1 drink is approximately 5 ounces of wine, 1.5 ounces of hard liquor, or 12 ounces of a malt beverage, so a beer or one of those really popular seltzers. Also, too, when you look at whatever someone's goals might be into surveillance and survivorship with excessive weight gain, alcohol is very calorie dense. So it's kind of for people who are maybe focusing on, you know, avoiding continued weight gain or whatever the situation might be, it's kind of empty calories. So that can sneak up in there too. So let's talk then about animal products. So both with stem cell patients as well as cancer patients in general, we hear this all the time, like, oh, I should stay away from all meat, all animal proteins, all of this stuff. That's not necessarily true. So when we talk about, or let's talk about red meat. So these guidelines show and evidence show that someone can safely consume, up to 18 ounces or a pound plus 2 ounces of red meat per week without increasing risks for cancers of the large intestine or the colon, and then the rectum and the anus. So you can have it once in a while, but if you're consuming it like some of these like bodybuilder guys or someone who says to me, I eat a steak every single day, that's where the risk comes in. But if you're having, lean piece of red meat once or even twice a week, that's not going to significantly increase risk. Now, what we want to stay away from completely, on the other hand, would be any type of smoked, cured, or processed meat. So, examples of this: deli meats. During the transplant phase, we talk about staying away from these for food safety purposes, but for this now it's moving into cancer risk, but staying away from deli meat, smoked sausages, hot dogs, smoked salmon, smoked barbecued meats, like it's kind of redundant I'm saying this, but on the smoker, because even consuming just a few grams per day of this can increase someone's risk for those same cancers of the large intestine and the colon. So people can completely eat like chicken, fish. You can certainly consume whole soy products like tofu, soybeans, soy milk. You can consume eggs. Eggs are okay. That's where there's all of these notions and kind of this outdated literature that we need to stay away from this stuff. But it's not necessarily true. Just eat a variety of things. So don't just eat chicken every day. Throw in some seafood in there if you like it and if you don't have an allergy. Throwing in some plant foods. So we kind of talked about, or I mentioned soy. But if someone wants to do things like quinoa or any type of legume, so lentils or chickpeas, kidney beans, those are some great options too. So vary the protein routine. I get asked a lot about the soy products as it relates to breast cancer patients. So not necessarily stem cell patients, but more or less the breast cancer patients. But I just mentioned it because it's a frequently asked question. We also want to do our best, moving into surveillance, of limiting our consumption of sugar-sweetened drinks, so things like pop, juice with added sugar, sugar-sweetened teas, those kinds of things. You want to stay away from those. We also want to limit consumption of these so-called fast foods that are high in added sugars and fats. These guidelines have a lot in common with other, the prevention of other chronic illnesses. So the prevention, of like diabetes, the prevention of heart disease. And believe me, we know these things aren't super nourishing for us, like pastries or like French fries and all that stuff. And I'll never, ever be that dietitian who says I don't eat them, but eat them sparingly. And kind of, I like to say it, using them for special occasions. So, I have a special dinner this weekend, so I definitely will be having a piece of cake to celebrate, but just keeping it to just a few times, if not once per week. Now, when we talk about the good stuff, we really want to keep it simple for the most part and eat a diet or an eating habit, lifestyle, that is abundant in whole grains, vegetables, and fruit. With our bread products, so like our breads, crackers, pastas, if we could possibly, our goal is to have those be whole grains. So instead of thinking white rice or jasmine rice, choosing a whole grain rice or a brown rice. And same thing too with pasta. These foods, fiber is just really great for us. It's great to help keep our blood sugar stable. It's great to keep us full, and it's really great to help keep our blood pressures lower. which in turn can have that domino effect as far as reducing risk or incidence for heart disease. Now, 2, eat more fruits and vegetables. It's like that thing growing up that your mom and dad always said to you, like, I remember my mom was kind of like nagging me to eat all my broccoli or my green beans, and now I know she really knew what she was talking about. We would like at least 1/2 to 2/3 of our plates to be fruits and vegetables. They're so nourishing for our bodies. They're the best source of these vitamins and minerals for us to consume. They're also a great source of fiber and a good source of water, too. So there's that extra little, the more fluid we consume, almost always, the better. So that's going to be really, really good. So I already mentioned, the risk, or some of the risks for people after they've had a transplant being, the osteoporosis or osteopenia. That's because of, depending on how much steroids someone has had, that's a known side effect from that is early onset of bone challenges. So again, strength training if you're able to, if someone's physically able to, and then making sure that you're supplementing with an appropriate calcium and vitamin D supplement. One of the other risks for stem cell patients is they're at risk for things like weight gain in the post-transplant period, as well as high blood sugar secondary to chronic steroid use. So that's where, too, all of these guidelines I've talked about really work towards that goal as far as keeping someone's weight steady and avoiding weight gain. And then, avoiding weight gain once they're feeling better. It's one thing if someone has lost weight during the transplant phase and they're gaining weight back up to their baseline. That's what we want. But what we're talking about here is continued weight gain kind of beyond that point. And 2, they're really the best foods to help, keep in mind our blood sugar goals. So, some good things to note. So that's really what I had to talk about today. So I guess we can open up the line for questions. I have about 10 minutes for questions.
Great. Jenny, can you tell our callers how to ask a question today?
Thank you. If you would like to ask a question, please press *1 on your telephone keypad. And if you're using a speakerphone, please make sure that your mute function is turned off to allow your signal to reach our equipment. A voice prompt on the phone line will indicate when your line is open. Please state your name before posing your question. Again, press *1 to ask a question. We'll pause just a moment to allow everyone an opportunity to signal for questions. And now we will go to our first question in the queue.
Okay, sure.
Yes, can you hear me?
I can hear you perfectly fine.
Okay, great. My name is Pamela, and I had my stem cell transplant done in 2011.
Wow.
And I've had some, I'm thankful, yes. But I have had some issues with the steroids from the beginning. So I've had my both hips replaced and a shoulder, And so I'm trying to figure out, and now I'm dealing with kidney stones. So I'm trying to figure out the best thing for me to do but I'm learning how to drink more water, and I'm doing physical therapy right now too, and trying to figure out the best diet, but you told me so much, in earlier. So
yeah, so I should
get on board with everything.
Yeah, and those are definitely 2 very complex things going on. So, I probably should have said this earlier, so I'm not able to answer very detailed questions like that because that would merit, looking at your chart and seeing your detailed history, any medications, other things that could be going on. So if you don't mind me asking, where did you have your transplant?
In Greenville, South Carolina.
Oh, you're calling from South Carolina. That's so cool. But I would just reach out to your director of your stem cell transplant program and say, is it possible that you all have a dietitian who could do a phone or a video visit with me who's within that healthcare system? And just ask, and they should be able to point you in someone who could provide you with more detailed information.
and you're just right on target because that's what I was going to talk to my oncologist about. Is,
okay.
To get me set up with a dietitian. Yes.
I think that's a great idea.
Thank you so much. I really appreciate this information.
Oh, I appreciate you too.
Thank you.
Mm-hmm.
And we'll move to our next question. Please go ahead. Your line is open. Participant, we're not able to hear you. If you're on mute, please press your mute function. Again, we're not able to hear you, but your line is open. Right, we'll move to our next caller. Please go ahead.
Hello, can you hear me?
Yep, your line is open.
Yes, we can.
Yeah, hi. My name is Rhonda Kokot. I had my allogeneic genetic transplant 16 months ago. The challenge that I'm dealing with is I lost a tremendous amount of weight. I wasn't a big person to begin with. My challenge is how to gain weight because when I was hospitalized for about a week, they didn't give me any food, but I had to live on a bag of fluid. That alone caused me to lose 15 pounds, and I was only 110 pounds when I was healthy. So, because a GVHD takes a lot of format, and mine one of the worst is the constant diarrhea. Right, so I basically deplete a lot of the food and medication that I take in, and I try to eat. When I became able to eat, at the beginning of the GVHD, I wasn't able to. I had to be very restrictive in terms of what I ate, not to trigger the GVHD to become worse. And now I'm able to eat whatever I want, but I try to be very careful not to eat like greasy or spicy. I try to eat a lot of proteins, and every time I do my blood check, weekly, I always ask how's my total protein doing, right? But for about a year, the past year, no matter how much I eat, how much protein I eat, I know I'm not supposed to eat too much protein because it adds burden to the kidney or something. My weight just stays the same. Thank God it doesn't drop, but it stays the same.
Right.
My challenge really is how I look like a skeleton.
How to gain weight.
How do I healthily gain weight? That's my
problem. So that's a really good question. So to kind of just go over some basics, I don't think I have enough information to go over the details, but anytime there's a cancer diagnosis in the body, it significantly increases our metabolism or how quickly we burn through food for energy. So that's where sometimes people will say, I'm eating, but you're not gaining weight. Also, when we look at foods to help gain weight, protein helps, but really, at the end of the day, the amount of calories that we're consuming, calories are king. So certainly incorporating some sources of fat that aren't greasy. So, like, say you were to do dairy products, choosing full fat instead of skim dairy. You could also do things like various nuts and seeds, so like peanuts, almonds, cashews, pistachios. You could do any type of peanut butter, as well as avocado is going to be a great source of fat. So protein is important, but even too, like generally speaking with, cancer patients, they'll really emphasize protein for weight gain, and that's part of the component, but really just eating more throughout the course of your day is going to be the most important thing. If anything, sometimes people will replace protein because it's important, but they'll replace like a source of fat for protein, and that, based on numbers alone, could cause some weight loss.
Okay, I see. And I have to be careful how much fat I take in because that will make diarrhea worse as well because of GVHD. So it's really there's a balance that I need to find out.
Yeah, there's definitely that tightrope balance. And like I said to the wonderful caller earlier from South Carolina, that might be worth a detailed one-on-one visit with your facility's dietitian. Almost all stem cell transplant programs, because you all are such unique, wonderful, complex people, they should have a dietitian working with them.
Okay, that's a good advice. Thank you. And is it true that taking in too much protein can also become bad, I guess?
Yeah, so that's a really good question. So there's certain people who we want to limit protein, but, consuming extra protein isn't going to harm your kidneys. There's that whole discussion where it can be harmful are like specific niche patients, like people who have kidney disease but they're not on dialysis yet. Like we want to watch those patients, but generally speaking, there's no need to limit your protein. Like a few extra grams of protein a day, like 50 grams, extra a day isn't going to hurt your kidneys.
Okay. Thank you.
Okay. Well, you're welcome. So I think I have time for one more question. And then, too, I don't know if this is possible if I were to get a list of questions, I could answer them as time goes by through electronic media, too. I'd be willing to do that.
That would be great because actually we did have some pre-submitted questions, so I'll make sure to share any. And just so all of our callers know, there is going to be a survey coming out after this call today. So on that survey, if you have any questions, we can forward those to Amy as well.
Yeah, and I'll do my best to answer them in a timely manner.
Thank you. Okay,
You're
we'll
welcome.
take one more caller for Amy.
And we'll go to that last question for Amy. Please go ahead.
Hello, this is Stephen O'Connell. Can you hear me?
Yes, I can hear you. How are you today?
Oh, I'm doing great. I had a quick question about, you mentioned bioavailability earlier and supplements, and I was specifically going to ask about vitamin D and bone health and supplements, and in addition to what you were talking about with dairy and some other obvious sources of vitamin D and some bone nutrition, what would you recommend for someone who has known bone problems even before this transplant, and then what supplements might be helpful afterwards in addition to nutrition?
That's a really good question. I love talking about vitamin D because it's actually one that there's so much research about it. So one of the neat things about vitamin D is that there can be a lab that's drawn for it to see really where someone's level is at. So I would say if you wanted to supplement at least with 2,000 units a day, and then you could, ask your PCP, or even, we have our stem cell physicians here draw it, and because of the fact that someone has had a transplant, it should be covered, hopefully, by insurance without astronomical costs. And then depending on what that level looks like, you could certainly increase based on what that level is. So if someone has a very low level of like less than 15, I tend to recommend supplementation with a prescription form from your doctor of 50,000 units weekly. So that's great. And it's a level who, if there's a deficiency, then we try and correct it with a supplement. The lab value in our blood will reflect in that really great.
And
great. Then as far as, you're welcome. And then just really quickly about calcium supplementation. So we recommend our patients take 12,000 milligrams a day, but we like to break it up into 2 doses in the morning and in the evening. So taking the 600 twice a day instead of the 1,200 all at once, just because your body can absorb that better if it's broken down.
Yeah, that's the one thing with supplements. A lot of it goes down the toilet. If it's too much at once, your body can't really absorb a lot of that. So,
and I'm going over, but I don't really care because this is so interesting. So I said I like talking about supplements a lot, but not so much with calcium. So calcium isn't one because it's a mineral that will come out in your bowels a whole lot. But when you look at vitamins, we classify them into water soluble and then fat soluble vitamins. So there's only 4 fat-soluble vitamins, and those are A, D, E, and K. But the other ones, what your body uses on a cellular level, you excrete in your urine or your sweat because your body's like, I've had enough. I need to get rid of the extra. So that's really interesting. That's a good point. Anecdote for anyone listening, calcium, if you were to add in a calcium supplement, it can cause constipation. So if you start taking one and you're like, oh no, I'm, more constipated than I was before, that's going to be the correlation there.
Well, thank you for that, Amy. We really appreciate everything you brought to this
you're so welcome
today. And again, if anyone wants to send in those questions, we will do our best to get everything to Amy and respond.
Yeah.
And remember, too, that she cannot answer individual medical questions, but she can definitely tell you what the guidelines and recommendations are in regards to nutrition. But Amy, thank you. We'll let you get your patients, and we'll move to...
You're so welcome. This is a bright spot in the day for me, so thank you for the opportunity.
Oh, absolutely. Thank you for being here, and believe me, we'll be in touch.
Okay, sounds good. Take care, everyone, and have a good Wednesday.
Thank you.
Okay,
and now
bye-bye.
We're on to our next speaker, Rhonda Kokot. Rhonda is a 20-year cancer survivor and stem cell transplant recipient. She was diagnosed with acute myeloid leukemia on December 28, 2001. After 6 months of chemotherapy and a pre-transplant protocol that included chemo and total body irradiation, Rhonda received a transplant at the University of Minnesota on July 26, 2002. Rhonda's transplant was part of a clinical trial that was testing the efficacy of using cord blood from 2 umbilical cords as the donor stem cell source. The transplant was successful, and Rhonda has gone on to live a happy, healthy, and cancer-free life since. Rhonda lives in the Chicago area and runs a creative branding agency called Simple Truth. In her free time, Rhonda made a personal goal of running a half marathon in every state to raise $100,000 for cancer research. She crossed the finish line on her 50th state in June of 2019 and has been a wonderful mentor and educator and supporter at the Link, and we appreciate her so. So, Rhonda, thank you for being here today.
Oh, my pleasure. I'm so happy that I could join this conversation. And if you could see my desk, I have pages of notes from Amy's presentation and wrote down the resource she provided at the American Institute for Cancer Research, which I have already tapped into that website, and it seems like it has just great information. So I'm really happy to be here. Would you like me to just sort of start with a bit more of my story and then kind of go into some nutrition thoughts that I have?
Yeah, share anything you want to about what you've done to stay healthy and take care of yourself after your transplant. So anything you want to share.
Awesome. Thank you. So I think that bio of me was pretty accurate in terms of the things that I went through for my transplant, but it has been almost 20 years to the, I'm 6 months shy of my 20th transplant anniversary, and I look forward to celebrating that. So the double umbilical cord stem cell transplant was very experimental at the time, and I'm so grateful that I got to be part of that clinical trial. So the source of those stem cells coming from umbilical cords, I think, for me, in a very positive way, changed my outcome. And I'm grateful that I was part of that trial. I was only about just turned 30 years old when I had that transplant, so was in a pretty healthy stage of my life and didn't have a lot of underlying conditions that would have complicated my transplant even further. So I have sort of had now 20 years to look at my recovery and want to just touch on a couple of areas that Amy touched on that I think have really contributed in the past 20 years to keeping me in a pretty healthy place right now. So I have a blog that I kept, and Jennifer, if you want to send out the link to this afterwards, I'd be happy to share for anyone who might be interested. It was probably one of the first blogs ever created back in 2001. It's called transplantthis.com, and it follows my journey of my transplant from just right before it, a couple days out through the transplant in my first year. And I wanted to go back to that this morning to just kind of remind myself of how I approached nutrition from the very beginning. And I can tell you that I didn't approach it well. And I kind of think I've divided my eating into three buckets. So what I call my transplant diet, which was pretty much anything that sounded good and would stay down. And that was probably, the first 100 days or so, even after my transplant. And that was, when I was in the hospital, sometimes it was Pizza Hut and Chipotle and Starbucks. And other times it was, trying to eat the hospital food that I was served, but that didn't always sound good. And one of the callers talked about that problem of losing weight. I had the opposite problem. I was on steroids and I gained a bunch of weight. And so I just watched myself kind of balloon during that time. I asked the doctors if I was the only transplant patient to ever gain weight during their transplant, and they assured me I was not. But the complications with steroids and graft versus host, which I had on my skin and luckily not in my gut, did make it, the steroids make it harder to eat a normal amount of food, I will say. So I kind of just approached my transplant diet of whatever I need to do to just get some calories in and feel good and try not to gain too much weight with the steroids. Then I would talk about my recovery diet being sort of the second wave. And this is when I started to realize, okay, I'm going to survive. I need to start thinking about how I want to eat so that I'm getting the right amount of calories, as I was still on a ton of medications, many of which, in that first year, anti-rejection drugs, steroids, every kind of antiviral, fungal, bacterial. Those drugs can often mess with your system and make you feel a little gross. So I tried to really just think about what were the foods that I could be eating that would be benefiting my health, but also that I could still continue to learn how I would need to moderate my weight and how I would need to deal with the longer term effects of my transplant as they arose. And so I would say that diet was maybe the first year out of transplant for me. And then moving into that third range where I would say I am now, which is the long-term health diet. And how can I maintain a healthy weight and a healthy lifestyle so that I could live the longest life possible. And for many of my friends, they see me as the intro said, I did run 50 half marathons in the past 15 years to reach this goal. And that was part of the exercise that I felt like I really needed to get. And raising money for cancer research felt like a really good way to tie a charitable give back component to my personal goal of staying healthy. And so the running and the physical activity are parts of my life and have been since probably about 15 years ago now. So just a couple of years out from my transplant when I started to run long distances. I'm running shorter distances now, but I still run. I still do get, as Amy mentioned, that 150 minutes of activity a week. I do target that, and I try to get that every week. I've also had some bone loss issues. I was only 30 when I had my transplant and went into menopause because of the total body irradiation. So I've been on hormone replacement therapy for quite a while now. And before I went on that, we were starting to notice some bone loss. And so that was part of the reason for the hormone replacement therapy. But strength training certainly has helped me to maintain that. And so I haven't had any stress fractures or breaks since I started on those therapies. The other, I think, predisposed conditions that I got that were probably expedited because of my transplant include high blood pressure and high cholesterol, and I also have had cataracts that started earlier from the transplant. So I am on medication for those things. I'm not on any transplant medications any longer, but I do take a heart blood pressure and a cholesterol pill every day. And what I've tried to do with, I think that the exercise and the diet really help contribute to keeping those numbers not as bad as they could be, right? So those are under control with very little medication. But my doctors are certain that the transplant probably had those onset earlier for me. I've also tried to move away from red meats, so I was very interested in hearing, the guidelines of 18 ounces of red meat per week or less, and I probably eat no more than about 6 ounces a week, and have really tried to cut that back in favor of whole foods, fruits and vegetables, and whole grains. And believe me when I tell you that there is no person on this planet that likes pizza and tacos more than I do. And so I've really tried to find ways to keep those things as a once a week, pizza on Fridays to me is a really great treat. And we usually make our pizzas at home to get those foods that keep me interested in eating and feel like a little bit of a reward while also managing my weight and managing, prioritizing the good foods over the junk. I also, I don't, this isn't like a conscious goal for me, but I don't eat fast food. On occasion, I'll have a McDonald's Egg McMuffin on a road trip, but that is the only fast food that I eat, and it's pretty rare. I am lucky that I cook and have access to food and can make meals for myself. And so home cooked meals are my preference because I can control the ingredients that go in and the nutrition levels that I'm getting out. So whole grains, fruits and vegetables, mostly, I guess it would be pescatarian, a lot of fish, I'll eat chicken, but mostly fish and vegetables is something that I've moved to probably over the past 2 years. And I actually find as I do that more that those foods actually make me feel good physically, as well as I think benefit my long-term health. So really, I think a lot of what Amy said is things that I've heard and really have just kind of collected and tried to build in over the past years. So I think that definitely it's contributed to me being a healthy, almost 50-year-old. My 50th birthday's in May, and feel like I will be able to, I am living the healthiest life I can live, having gone through such a significant health crisis in my late 20s, early 30s. So I feel like a lot of what Amy shared today is just really good advice that I'm glad you all are hearing now and learning, and hopefully with your nutritionists and your own lives can follow these guidelines, because I think that's definitely contributed to my success.
Thank you so much, Rhonda. You are certainly an inspiration to us all. And at this time, Jenny, can you remind our callers how to ask a question if anyone would like to ask Rhonda anything?
Thank you. As a reminder, to ask a question, please signal by pressing star 1 on your telephone keypad. And if you're on speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. Again, that is star 1 for questions. We will pause for a moment to allow everyone an opportunity to signal for questions. And we have a question in the queue. We'll go to that caller.
I don't have a question. I just wanted to say what a beautiful story. Thank you.
Oh, thank you so much. Last time I did one of these lunch and learns, Jennifer can tell you I pretty much sobbed the whole time I was talking, because it's still such an emotional thing for me, as I'm sure it is for all of you who've been through a transplant. So thank you. Thank you. I'm glad I'm here to share it.
And we'll go to our next caller. Please go ahead.
Hi, this is Shalina Laws, and I had my stem cell transplant in 2018. And so my question is, how did you kind of get back into being so active and running? So pre-transplant, I didn't run marathons or half marathons, more like, 3 miles, go for a run before work several times a week, but even post-transplant, I have not been able to physically run and can't figure out how to get back into having maybe that much exercise tolerance. Was there anything that you did to kind of help yourself get back into that ability to have that higher exercise tolerance?
Sure. That's a really good question. Thank you. I was kind of similar to you. Pre-transplant, I was not running long distances at all. I was, the person that would sign up for the turkey trot and then try to figure out how I was going to run a 5K in 4 weeks. And I ran periodically, but certainly not as part of an exercise plan for myself. I never did yoga and I never did strength training, so I was an occasional exerciser at best. One of the things that I learned as I was going into my transplant from the nutrition and doctors at the University of Minnesota was that, getting out of bed every day, taking some steps, trying to stay physically active would potentially positively, contribute to my recovery. So I was able to have a treadmill. The hospital had treadmills that they could bring into the room, which I found fascinating and awesome. And so I was able to get on that treadmill every day and take some steps and make sure I was walking. When I got out, though, it was certainly difficult to, walk around the block. And so it was just a little bit at a time till I got through that more acute phase. And I didn't start running again until probably about 2005. Well, it was the fall of about 2004. And the way I did it is I joined up with Team in Training, which maybe you've heard of, through the Leukemia Lymphoma Society. And I joined their half marathon program. I was a patient honoree, so I would go out and talk about, you can run a marathon and raise money. And thank you. You can do it. You can do it. And I decided, if I'm telling people that they should do it, maybe I should try to do it too. So I really started by walking. And I went out to that training every week and I walked as much as I could and very gradually built up that endurance and ability to just go further. And there were, because of the hormones, there were times when I'd have to back off because I would get a stress fracture. But it was just gradual over time and setting small goals and using the team and people around me to motivate me to get out there and do it. Because there are days, even now, there are days where it's hard to want to lace up my shoes and go out into the Chicago cold and run. But it's just sort of a gradual, I think, do what you can do and listen to your body when it's ready to go further. It will tell you.
Thank you.
I hope that helps.
I'm sure it did. Is there any more callers, Jenny?
And we do have one more caller in the queue. We'll go to that question.
Yes, I have a similar situation, and I love your the information that you gave about your transplant. I'm a 4-time cancer survivor, and I actually had 2 transplants, stem cell transplants. I had my own stem cells in 2018, and then in 2020, I did my daughter's, donated her cells. So as far as getting back for activity and all that, no one ever really gave me anything about nutrition per se. I just go about, trying to find healthy things like you talked about with eating more fish and eating more vegetables and try to do organic. And as far as activity, it was a day by day thing, like you said, you take a couple steps and then one day you may walk more, or I started out trying to walk in my neighborhood at first, and then I started walking longer. Now I've gotten up to maybe about a mile or 2 miles. So I'm 22 months out from the transplant. So it does take a while, and it does take a toll on your body. But like you said, you have to do what you can do, and what you can't do, and your body will let you know.
Yep. Awesome. And congratulations. And to the previous person who asked a question too, congratulations to both of you on your survival and your endurance. Any person who has gone through a transplant, and you've gone through several, knows what a difficult, life-changing in so many ways that it is. And so the fact that all of us are standing here today, or sitting here today, alive is a victory. Congratulations.
Yes, thank you.
Thank you.
There are no other questions in the queue at this time.
Okay. Well, Rhonda, as always, we just can't thank you enough. You are just a treasure to the link. And I want to thank everyone for being on our call today. I know there's probably many questions, so do feel free when you get that survey, you can put the questions in there, or you can also email me directly, and we will do our best to get as many of these answered as possible, because we know nutrition is an important part of your healing and reclaiming health in your life. So we certainly want to support you in that. In addition, I want to let you know we have some upcoming programs. Actually, next Thursday, we have a webinar about chronic graft-versus-host disease, but we will be hearing from an occupational therapist, another dietitian, and myself, and talking about having a better quality of life with chronic graft-versus-host disease in regards to those particular disciplines. So you will have more nutritional information available next week as well. And then for those of you that are dealing with chronic graft-versus-host disease, I also want to let you know that the Cowden Foundation is hosting their virtual symposium the day after our chronic graft-versus-host disease program. But they're going to be having all the updates on treating that disease. So a couple great programs coming up next week if you want to hear more, or if you just need any extra support, please feel free to reach out to us at 1-800-LINK-BMT. But again, thank you all, and especially you, Rhonda, and everyone have a great day.